Welcome to the consulting room. Today we are going to have a very important discussion. Birth asphyxia. This is something that a lot of mothers have encountered. And I have with me here very distinguished guests in the persons of Dr. Gloria Amponsah-Kodia and Ms. Dana Weber. They are going to be discussing the topic with us. They are going to share their insights into the condition with us. I am your host, Dr. Obeng. We'll take a short break, after which we'll resume and they will introduce themselves, tell us what they do, who they are, and what they are about.
December, Accra comes to a stop as voices rise, hearts unite, and melodies inspire. Be prepared for an intimate time in worship, praises, and celebration as the Pencoats under the auspices of Peniel SDA Church proudly presents the third edition of the annual musical concert, Voti Dilode, under the theme Faith and Fusion, a night of inspiration and celebration. This event is happening live on Saturday, 13th December 2025 at the Wesley Towers, Reach Accra. The time is 4 p.m. to 8 p.m. It promises to be an unforgettable evening of choral excellence, worship, and creative expression. Grab your tickets now for 100 Ghana cedis regular, 250 Ghana cedis VIP, and 450 Ghana cedis for a family of 5. You can dial *800 *890# to purchase your instant ticket and be a part of this divine experience. Come, let's join in faith, where every note tells the story of praise. The Pencoats, witnessing the gospel through music.
Hallelujah. Welcome back. Dr. Gloria and Ms. Dana are going to introduce themselves and tell us what they are about before we dive into the real issues. Dr. Gloria, please, you're welcome.
Thank you.
Ms. Dana, you're also welcome.
Thank you, Dr. Obeng.
So from Dr. Gloria, can you please introduce yourself to us?
All right. Greetings to you, viewers. I'm Gloria Amponsah-Kodia. I'm a pediatrician at the Ejiso Government Hospital, so I take care of sick children. I also work with Healthy Kids Foundation as the executive director, and what we do is that we promote health in children by giving health education on conditions that affect children. And then we also have a rehabilitation center for children with special needs. So, in a nutshell, that is who I am.
Okay, thank you very much. Ms. Dana, can you please?
Thank you, Dr. Obeng. I'm also Dana Weber, a pediatric nurse at KNUST Hospital.
Okay.
Just as Doc said, with pedics, we're just passionate about kids' health and maintaining their health at all times, all around the year, and making sure that every mother goes home with a healthy baby and all children at every stage is healthy for better development. Thank you.
Thank you very much. And you are welcome once again to the show. And thank you again for honoring our invitation.
Thank you.
So we will jump right into it. Dr. Amponsah-Kodia, please, can you explain to us what birth asphyxia is?
Okay. So, when we say birth asphyxia, some also say perinatal asphyxia. It's the same thing. So when a baby is born and then in the first few minutes of life, the baby is unable to get oxygen or air into the body, then we say this baby has asphyxia. So a baby takes in oxygen into the body by crying when the baby is born, comes out, it cries, takes in air, and then this air contains oxygen. So the oxygen goes into the brain, the other parts of the body. And that is very, very vital for survival. And so if a baby does not cry or is unable to breathe normally so that he gets oxygen into the lungs and then into the rest of the body, then we say this baby has birth asphyxia.
Okay. And why is it important?
It's very, very important because of the problems that can happen when a baby does not take in air or oxygen. The baby can die. In fact, about 28 approximately 28% of all newborn deaths are as a result of birth asphyxia. Okay. That's very, very serious. So about 28 out of 100 babies who die as a result of birth asphyxia. That's global statistics. But you know that when it comes to Africa or Sub-Saharan Africa, it's even higher. It's even higher. So it causes death in babies. And even for those who do not die, the long-term effects can really significantly reduce the quality of life. And so we have to talk about it and prevent it. And even if by some reason we are unable to prevent it, manage it really well so that we reduce the long-term complications that can happen.
Okay, thank you very much. Ms. Donna, you've been nodding your head. Is there more you want to add to it?
Okay, just a bit to add to what Doctor has already said. I think we should bear in mind that it's not just about babies breathing after birth or baby being able to take in oxygen after birth, but there are some timelines that go along with that. And it's assumed that every baby that is delivered should be able to be breathing on its own within the first minute of life. So when after, let's say, a minute, 2, 3, even to just 5 minutes, then we have dire consequences. Just as she said, if to be on the best side or the safest one is even to die. So when it comes to birth asphyxia, though the death rate is higher, being dead is even better than being alive, because the dire consequences she was talking about, Dr. Bain, I know that our viewers at home, if you're supposed to go through these consequences, it's better off having a baby dead after going through what we are discussing today. So that is how important this topic is and why we need to take steps at all costs to at least, if we can't prevent or at least save most babies from this death. Thank you.
That's interesting. So how common is it, birth asphyxia?
Globally, about 2, the figures vary. So some say 2 to 10 for every 1,000 deliveries. Okay, so 2 or 10 people or babies born, out of 1,000 babies born, may develop birth asphyxia. In Africa, it's supposed to be higher. Unfortunately, we don't have a lot of data. You know, we don't publish a lot, so we don't have a lot of data. But I chanced across one publication from Tamale Teaching Hospital. So they purged, it's around, I think, 17% of all their NICU admissions. So NICU is neonatal intensive care units. So the newborns who are sick, who are admitted, about 17% of them are as a result of birth asphyxia. It's quite common. It's quite common, and the death rate is also quite high. So we can go with the data from TTH and then say maybe 17, but it will vary across different hospitals. Yes, but it's quite common.
Thank you very much. So, Ms. Donna, can you talk to us about some of the causes?
Okay, so talking about the causes of birth asphyxia, I would say that I would group my causes to, let's say, 2, religious, or let's say 3. So religious aspects, maternal factors, and maybe conditions of the baby in utero. I would say religious aspects because there are times when mothers come to the labor room and due to certain beliefs would not permit midwives or doctors to do their work as is expected. So someone comes in labor and you want to do VE, would tell you that no, I'm not supposed to expose myself. There are mothers who are very anemic, will come to the hospital, you tell them no, you need to take blood, and we tell you that my religious belief doesn't allow me to take blood. And there are times when mothers need to go through emergency cesarean sections, emergency procedures, and because they are waiting for their significant others to decide, or due to what they believe in religiously, will not allow them to, let's say, do what is expected, and for that matter, these babies stay in there, get distressed, come out asphyxiated. Then let's go to maternal factors. So there are times when mothers, we call something eclampsia or pre-eclampsia as a result of high BPs. Mothers go through gestational hypertension, and sometimes, not all of them, would end up having eclampsia or pre-eclampsia, and therefore predisposing that baby to asphyxias. Then there are other causes like uterine rupture or placenta previa and the abruptious, whereby the placenta discharges from the uterus even before birth. That one too, there is cut off of oxygen and other nutrients to the baby, and for that matter, baby gets distressed inside before even coming outside. There is this issue of CPD, cephalopelvic disproportion, whereby baby is ready to come out, but circumstances within the pelvic floor will not allow baby to push outside, and for that matter too, you realize that these babies come out already asphyxiated. And then when we come to the babies themselves, sometimes we have this issue of, let's say, cord around neck, cord prolapse, the cord that is supporting oxygen and everything to the baby coming out first, even before these babies come out. And sometimes prematurity, when babies are born before their time. And there are other babies too who have some congenital issues in utero. Most of these babies also come out with asphyxia. And so when we want to talk about the causes, I think the causes alone can just take up all our time for discussion today. There are a whole lot of factors. I think there are just few that I have mentioned.
Okay. Dr. Aponsa, could there any add-ons?
Yeah. So what Donna talked about, so basically any condition that will, in the mother, that will compromise or reduce blood supply to the baby, okay, or oxygen to the baby. So she talked about hypertension, which is one of them. When the blood pressure is also very low, there are people who have low blood pressure. So the ability, you need a very good blood pressure to get blood to the placenta and then through the cord, then to the baby. So persistently low blood pressure in the mother can also affect or predispose or increase the risk of the baby having asphyxia. And then if there are heart conditions in the mother, problems with the lungs or breathing in the mother, because the mother has to get a good supply of oxygen so that he can give to the baby, some to the baby. So issues with placenta, she mentioned them, the uterus itself. The baby lies in the uterus, so if something happens to the uterus such that blood supply is cut off or reduced, so uterine rupture, she mentioned it. And even during the labor itself, if the mother bleeds excessively, that will also reduce the amount of blood that can get to the baby. So anything that will reduce blood supply to the baby or oxygen supply to the baby can put the baby at risk of birth asphyxia. And I think she mentioned the individual conditions: mother, the placenta, the cord, then the fetus as well.
Okay, thank you very much. So again, after a child is born, what are some of the symptoms you see initially or signs initially that points to the fact that this child may have birth asphyxia?
Okay, so when the baby is born and he has asphyxia, what you'd notice is that the baby is not breathing or struggling to breathe. Very shallow breathing, takes in one breath and then waits for a while before it takes another one. That's called gasping. that's not very, very good breathing. So they are not breathing at all, or they are gasping. Very shallow breaths and very, very few breaths in a minute. And then you also notice that they are blue. So we call that cyanosis. It's the oxygen in the blood, and then that gives us that color. So babies are born, they are pink because the blood is containing enough oxygen. When they are not getting that, the color becomes bluish or dusky, sometimes pale too, because they may have lost a lot of blood. And then they are not sucking as well. Some may not even cry. They are very floppy, limp. You see, babies are supposed to be active. When they come out, they are crying, they are moving their limbs, everybody is happy, hallelujah. But these babies come out, they are not moving their bodies that much, they are not crying, the color is not good, they are not able to suck. Babies will latch on, healthy babies will latch on to the breast and then start suckling. It's a normal process, a reflex mechanism. So babies who are asphyxiated are unable to also suck. When it's very severe, they may not be able to suck. And then some may also have what we call seizures or convulsion. So a part of the body may be moving, jerking repetitively. So the child is having, or the baby is having seizures or convulsion. That means something is wrong with the brain. So asphyxia, that's also one of the consequences or the features that you see when a baby is asphyxiated. Sometimes too, they are unable to produce enough urine. You see, you need the blood to flow to all the vital organs, so the heart, the kidneys, and then they can produce enough urine. When the baby is asphyxiated, blood supply to the kidneys are also reduced, so they may not produce enough urine. These are some of the symptoms and signs that will tell you that this baby is asphyxiated.
Okay, thank you. So whilst you were talking, you kept mentioning cry, cry, cry. It looks like when a baby cries after being delivered, it's one of the moments where crying is a good thing.
Yes.
Can you briefly let us know the importance of that cry to the public?
Okay, so when a baby cries, when a baby is in the womb, so he's a fetus at that point, he's not breathing, he's not crying. All the nutrients and then the oxygen the baby is supposed to get is from the mother. So through the blood supply of the mother, it gets to the uterus. The uterus is what the baby lies in or the womb, commonly called the womb. The blood has to get to the womb, then it gets to the placenta, and then there's also a cord that connects the placenta to the baby. So when we cut the cord, you see that the umbilicus or the navel, when it heals, then you get the navel. So the cord connects the baby to the placenta and then to the mother. So he doesn't need to cry. Somebody is doing all the work for him. He gets the oxygen from the mother, he gets the nutrients from the mother. But when the baby comes out, now you're on your own, no? You have matured. You say you come out and cry. So get your oxygen by crying. So when the baby cries, the lungs, it takes in a lot of air. That first batch of air that rushes into the baby's lungs, it expands the lungs. So all the water that is left in the lung, when he's in the womb, he's surrounded by water, he's swimming in water, he's breathing, there's water going into the lungs instead of air. So now when you take in that gush of air, the air now goes to dislodge or push out the water, because now you are on earth. Lungs should be filled with oxygen, air, not water. So it pushes out the rest of the fluid or water in the lungs. Now the gush of air that also contains oxygen goes into the lungs, gets into the blood, gets into the heart. Now the heart pumps this blood, which is rich in oxygen, to the rest of the body. Because remember that when you cut off the cord, you have cut off, severed all forms of supply from the mother to the baby. And oxygen is very, very vital for all the organs in the body. So when the baby takes in that cries, when he comes out, that's change in environment, the shock, the different temperature and all that. it causes the baby to cry. It's something that God designed. So when the baby comes out, he cries, that act of crying causes air to flush into the lungs, and then oxygen will get to the rest of the body. So when a baby cries, everybody is happy. That is, like you said, one of the times that when a baby cries, we are all happy because it's so vital. It's doing so many things. That single act of crying is doing so many crucial things in that body. So every baby must cry. All the babies in the womb, we are telling you, when you come
Crying
out,
is a positive
you have
thing.
to cry. Yes.
Okay, thank you very much. Ms. Donna, so from everything that Dr. Amposa-Kudia has said, and from what you also talked about, the causes, the symptoms, when the child is delivered, is there a special tool that is used to assess for the asphyxia, or do you just have to spot the signs or the symptoms before you can attend to that baby?
Thank you very much for your question. To add on to what Doctor said just before I come to mine, I think all that she described, talking about the fact that when a baby cries, everyone gets happy. We term that as a golden moment. Do you get it? So it's so important and it's so satisfying that you do delivery and baby comes out, a baby is crying. It's so satisfying. It gives you that strength, the joy, everything that comes along with labor and delivery. And also to come to my question about the fact that, like, when babies come out, if there is any special tool that we use to assess whether baby is okay or baby is asphyxiated, we have this tool that we call the ABGA score. So baby is assessed right after birth in the first minute, and baby is assessed once again after 5 minutes. Just as I talked about the golden moment. So golden moment is mostly within the first minute of life. You come out, you cry, it's a golden moment for all of us. That is the first minute. That means oxygen has been taken into the body and every other organ in the body is going to function perfectly. So in the first minute, we are looking at the appearance. Doctor talked about it when he asked of the signs and symptoms of asphyxiated baby. So we are looking at the baby. How is the appearance like? Is the baby okay? Is the baby pale? Is the baby cyanosed? You are looking at that. So that one is A. I talked about ABGA score. Then you look.
So do you score?
Yes, it's a
Depend on
score.
the color.
Yes, it's a score. We score each of these to know that baby is doing well or not. So I think it's mostly like either is 0, either is 1 or 2. You are looking at all these things to see if baby is okay. So you score gradually. But mostly asphyxiated babies, we can't even count to 10.
They don't get to 10.
Yeah.
So
Yes.
10 is good, like
Good.
perfect score.
Yes.
The baby is well.
Asphyxiated
asphyxia.
babies, you can hardly, in the first minute, you can hardly get to even 5. Sometimes, most of the times. So maybe that was why I didn't mention up to that length. And then you're also looking at the babies, like the skin, we have talked about that. Then you're also looking at grimace. What is happening when the baby came out? We need to know all that. Then pulse comes before grimace, so you look at the pulse. Doctor said they will mostly have weak heart rates. So you are getting something less than 100, pulse less than 100. Baby is not really taking in enough breath, shallow breathing. That one too, you need to score. Mostly, just as I've already said, you are not getting to anywhere between 5 and 10. So for the benefit of our discussion, I might not necessarily go there. Okay. Then you also look at the, how do I even put it?
The respiration.
No, like, so appearance, pulse, grimace, and then baby's activities like the flexion, extension, and all those stuff. Doctor said when they come out, they are floppy. So like, unlike every baby, just as she said, you see them kicking, moving their legs and all that. These babies come and then they are just quiet. They are the quiet type. They are just there. You hold a hand, it goes back. So like, less activity. You get babies that are, let's say, so asphyxia is being grouped in mild, moderate, and then severe. Those in mild asphyxia, you can get them doing some little activity, and that one to definitely, you just be within 0 to 5. You still be within 0 to 5 in the first minute. Sometimes after 5, within the 5th minute, you can get something higher than 5 to, let's say, 10. But we're talking about proper birth asphyxias. And then the last one, you look at the respirations. Mostly you see their abdomen just going up and down rapidly. Very fast respirations, because they are trying to catch in air, work of breathing and everything. Like, everybody is trying to help to support the baby to breathe. So that is one of the specialized tools that mostly, I would say, midwives use to assess the state of the baby, and to also know if this baby is asphyxiated, mildly, moderately, or severely asphyxiated.
Thank you very much.
Thank you.
I think we are learning a lot today. So for those who don't know, ABGA is an abbreviation, right?
Yes, please.
So an acronym.
Yes, please.
Okay. So please, let's talk about the prevention. How can we as health workers and even the mothers work together to prevent birth asphyxia?
Education, and we are doing that today. And so radio, TV education in the hospitals, education during the antenatal visits, in the churches, in the communities. People must be aware, not just the mothers, the husbands, the in-laws, the grandmothers. They should all know about birth asphyxia. And if our community health nurses can go into the communities and then educate them, that would be great. At our churches, health workers can do that. Antenatal clinics, very, very, very important, because they give a lot of education there. And there are times that they have even family meetings. So you don't come alone, you come with your spouse and those who would help support you when the baby is born. So people should not miss antenatal visits. And sometimes women will wait till they are almost about to give birth. That is when they start visiting the antenatal clinic. So antenatal visit, not only do they give education, they also assess the mother. If there's any condition that will increase the risk of the baby being born with asphyxia, they can manage it. Even for those ones that cannot be treated, they may know how to reduce the severity. If a mother, pregnant woman, has very bad asthma, uncontrolled, okay, during the ANC, they can let an obstetrician manage that woman. High blood pressure, other conditions, heart failure or heart conditions, myocardial infarction, so many things that can affect blood flow to the baby can be managed or addressed during antenatal visits. And then we also advise mothers when labor sets in. Okay, so first of all, when they go for antenatal visits, whatever education they are given, whatever medicines they are given, whatever they are told to do, they have to comply, try and comply. And then when labor sets in, people will say, when I go to the hospital quickly, right now that labor has started, they are going to examine me so many times. By the time the baby comes out, the baby's cheeks will all be swollen and all that. So let me wait a little. And then when the baby is just about to come out, then I rush to the hospital. But you see, when you go early, some of the advantages are that as they are assessing you, they are not just checking the progress of the labor. They also want to know if the baby's heart is beating well. Now, if they notice that there's an abnormality with the heartbeat, they can quickly intervene. In very, very good centers, the theater is ready, Within 5 to 10 minutes, when they notice that the heartbeat is not as expected, they can quickly get the baby out and then do proper resuscitation or helping the baby to breathe. And you will not get the consequences, the effects, or the severe form of birth asphyxia. So when labor sets in, mothers should go, pregnant women should quickly go to the hospital. It's better for them to examine you so many times and have the baby come out with their cheeks swollen than for the baby to have asphyxia. Okay, so go when labor sets in. And our hospitals, we should also have the resources to intervene when we pick abnormalities. When the placenta quickly detaches, the placenta is supposed to detach from the womb after the baby has come out. So if it happens before the baby comes out, then that means we have to quickly get the baby out. So if you are in a facility where you cannot perform surgery, cesarean section, and then what happens to this baby? The baby may come out dead or severely asphyxiated. Do we have the transport system, proper referral system, so where we cannot provide the right interventions for the mother and baby, can we quickly, do we have links with other facilities? Do we have transportation system to quickly get this woman to a place where they can help the baby and the mother? So our referral system, transportation, okay, of the mother and the fetus or baby to a place where they can get help, very, very important. And these are some of the ways that we can reduce asphyxia. And then the religious aspects, as Donna mentioned, very, very important. You know, Ghanaians are religious, so you can't take away religion from that. Somebody will tell you that my pastor says a knife will not touch my body. But when you are cooking and it cuts you, is it not a knife?
I know.
A knife will not touch my body. This baby will come out normally. It's good to have faith, but you know, God has given wisdom to men. So if they say that your baby's position is not good, he cannot come out the natural way, cesarean section should be done, or there are ways that we can do to help the baby come out without any issues. Don't say that in my family nobody does surgery. So our pastors should also help us, work with us, okay, and then educate your church members on some of these things. There are times that, yes, God uses men to save people. It's not only prayer, he uses men too. So that's one is very, very important. We can prevent a lot of cases of asphyxia if we are complying with what the doctors say.
Okay. Ms. Donna, any add-ons?
Yeah, so just as she talked about the religious aspects, we should also know that preventing birth asphyxia is a collective responsibility. Our husbands, she talked about grandparents, everybody, you and I, from the home to the hospital, everybody has a role to play. So as husbands, as grandparents, as aunties, we are saying that birth asphyxia is very, very important, that we make sure that no baby should be delivered and at the end of the day go through this process or have this condition that we term birth asphyxia. Because when it happens like that, definitely there's not going to be any joy at home. The money that goes into it too is expensive, and if the baby dies, most of these mothers get depressed. So we don't want that to happen. Tell your ward, your sister, your wife, your in-law that is pregnant, that even if she needs to take a decision at the hospital and none of you is around for the sake of the baby, she should be able to do that. Because some people get there, then they are told that, oh, your BP is high, we might have to go to the theater right now. We'll tell you that my husband is not around, and for that matter, I cannot do surgery. And some of these people wait until like the last minute when everything could have been salvaged earlier on. And then there is this situation of we health professionals not really knowing, like because of maybe a lack of understanding, or maybe the fact that we've not been even trained, do you get it, to do, I would say, resuscitations. right after birth. There are times when babies are born, they are not in good shape, they are not breathing well, but unfortunately their attendants at the moment can't even resuscitate or do not even know what to do. And for that matter, would have to carry baby running to get to a place that they think can get help. So we would advocate that all health professionals, theater nurses, pediatric nurses, pediatricians, anesthetists, midwives, and everybody, ONG specialists and everybody, we should all come together, make sure that we know what we are about, so that when we are faced with a situation, maybe the few minutes that we have on our hands, we can do something, if not to even prevent everything, at least to put the baby in a milder range, so that parents or mother would also have some level of joy. Do you get it? Okay. And also, our hospitals, most of our health centers do not have the necessary equipment to even manage this situation. Yeah. We are talking about we being trained. Yes, I have been trained. I know that when a baby comes and needs help to breathe, I'll need bag and mask. I'll need oxygen supply.
So, Ms. Dana, we will come to that. I think we need to talk into details about that. But we'll take a short break. After the short break, we'll resume and we'll jump right into the facilities. Thank you.
Guys, I welcome you all to Gospel 101 TV show. My name is Selassie Evelyn, and I'm thrilled to be your guide on this uplifting journey into the heart of gospel music and inspiration. What you made ye sui, yet de ekuku dam. Get ready for a television show that will challenge, uplift, and remind you of the incredible power of God. Yeshawo Bose, yet the life-changing stories.
We are not going to marry when we go to heaven. It is very true. But if we are not careful, our bonnet heaven.
Good music videos. So tell a friend to tell another friend, say, Gospel 101 Jumedieno has come. It is not just a show, it is going to be an experience.
Gospel 101, showing this and every Wednesday at 6 p.m. right here on Hope TV.
Ahoya! God is good all the time. Oh, my brother, my sister, in the period that we are, there are so many things that we are facing. Crucibles, tough times in our marriages, in our relationship, at our workplace. I am going to encourage you, bring you hope, joy, messages of hope. These are messages of experience that we had in recent peacekeeping mission from Southern Lebanon. A new series starts in the Crucibles with Christ on Soldier of the Cross. I invite you for this period on Soldier of the Cross.
Soldier of the Cross, showing this on every Sunday at 7:30 p.m. only on Hope Channel Ghana.
Welcome back. For those who are just joining, we are discussing birth asphyxia, a very important topic. It's something that most mothers have gone through, and it is a very debilitating experience. So where we left off, let's talk about our facilities. How prepared are our hospitals to manage these conditions?
So just as I was talking before the break, I would say that most of our hospitals are not really ready or prepared when it comes to birth asphyxias. Let's go to CHIP centers, our clinics, and even sometimes hospitals. I'm just laughing because not until, let's say, recently, even I would say that let's say 5 years or let's say 6 years down the lane, my facility might not even have been in that position to fully, I'm not saying that we can't, but we are talking about fully taking care of a baby with asphyxia. But by the grace of God, I think we have this PSG, Pediatric Society of Ghana, who are also ensuring that babies and children also live a better life, have good health, and for that matter, most of the time, they go through facilities, advocating to leaders, and also making sure that we have the necessary materials and equipment that will help in especially helping these babies. So most of our facilities are not prepared and do not have them. But we are saying that even it starts from somewhere. The first one is to just train your personnel. Let them know that this is an emergency, and for that matter, at least the little that you can put in place can also save a life. If you already know that this mother or this labor is not progressing well, if I'm taught to assess well and know that things might not be well when the baby comes out, I have, let's say, within an hour or something to even prepare. If you have to call, you can even call in for backup so that when baby comes, like Church of Christ and KNUST Hospital, if personnel at Church of Christ know what they are about, they have been able to assess to see that, no, this delivery might be very difficult. They will just phone in to Tech Hospital and tell you, Tech, we have a case like this, maybe right after delivery, we are bringing a baby. Tech is ever ready. We are prepared, waiting for such deliveries. We had one from Bomso Clinic last time, and baby was fine after, let's say, 2 or 3 days, and they were discharged to go and be with mother back at Bomso Clinic. So if the facilities are able to train their personnel well, at least if you don't even have the necessary equipment and your personnel know what they are about, we are still able to save these babies, if not, let's say, from death, at least putting them in a milder range for better development.
Okay, thank you very much. So let's talk about accessibility to facilities. I mean, the hospitals that we have, they may be well equipped and all that, but if patients are not able to access it, what's going to happen?
So the delays, you know, we talk about delays in healthcare, and one of them is delay or when you delay in getting to the facility. So accessibility is our roads are poor, and sometimes even the distance. That some pregnant woman will be in some rural area somewhere, and getting access to the hospital is a big issue. And you know, that is also why the CHIPS compound or CHIP concept came in, so that we get clinics, some kind of health care to the people, close to the people as possible. But there's a limit to what they can do. Okay, so we need to give better roads, we need to get better transportation systems, and then we also need to equip the facilities that are closest to these people. Every district should have a district hospital that is well equipped to manage babies who are asphyxiated or pregnant women, so that they can have safe deliveries. Okay, so it's true. I mean, transport, access to the hospital is still a big challenge in Ghana, but we hope that things improve in the coming years.
Okay, so now a very important question. Let's talk about the cost of treatment for these babies. I think that's one of the biggest challenges people have. And so sometimes they would request that you discharge their baby for them to go.
Okay. Thank you, Dr. Obi. In fact, it's one of the biggest challenges when it comes to managing birth asphyxia. Cost involved. It really hasn't got to do with, let's say, medication as you giving the child or the baby medicine, but the main thing that we do here is oxygen supply. And yes, it's a form of medication, but not necessarily you having to swallow it or reintroducing it to the body through maybe any other route, but through your lungs or through the nostril. It's costly, unfortunately. Apart from that, there are also other equipment like these CPAP, and I think Kumasi, we are doing well. We have our KCPAP, which is the Kumasi improvised CPAP. CPAP is actually a machine that helps these babies to also at least reduce the stress of breathing. So just like we give oxygen, that one is a continuous positive airway pressure. Do you get it? So instead of these babies having to breathe on their own, using all the efforts they have, other than also using some to even digest the little that we are feeding through NG tubes and all that, CPAP comes in to help. And in areas that we do not have these machines, Kumasi has introduced or improvised one. So we have our KCPAP, which is cheap, though it's very cheap. But also there again, its effectiveness. Apart from that, there are certain things that you even need. This three-way, in fact, so on the whole, managing asphyxia is costly. It's costly. I think the government is doing well by this NHS that people would have to just bring in your card. Once a mother delivers and you have insurance, mostly your bill is slashed. And even on admission, I think first week or so, you don't pay anything for accommodation and all that. But we are still praying and we are still advocating that parents, especially fathers and their other relatives, should also help these mothers to cope. Sometimes it's not just about the money. It's about the fact that they are waiting too much at the hospital, and for that matter, they even want to go home. So yeah, it's costly. For that one, we can't do anything about it. But we are looking at the end results. Some babies go through these costly treatments, and they are able to at least get stabilized. Though sometimes it takes longer because they will depend on oxygen for a while. But on the whole, it's costly. Government is doing their best, but we pray that maybe they can do more. They can do more by bringing in these CPAP machines. PSG2 is doing well. I think my unit, our first value CPAP that we received was through, yes. So we are praying that the government would also come in and then help. Once the babies come and they are asphyxiated, we can manage. But the things that we really need to put in place, they are all costly. And I think it's not just here. Even outside too is the same thing. So managing birth asphyxia on the whole is costly.
But it's worth it.
It's worth it. Yes.
Okay, thank you very much. So Dr. Mponsa Kudia, birth asphyxia, can it be predicted before labor?
Yeah, so before labor, yes, so if the mother's blood pressure is very high, sometimes it's so high that it leads to what we call preeclampsia or eclampsia, where the mothers are actually convulsing. Okay, so there are conditions in the mother that will predispose or increase the risk of birth asphyxia in the baby. So these conditions can be picked up during the antenatal clinic or care and then managed. Yes, so even though you can't predict in all instances, to some extent, if the mother goes to the antenatal clinic, he gets proper assessment, some of these things can be picked up.
Okay. So, follow up. What is the message you are sending to mothers to do? Like, they are responsible for that in order to prevent.
In fact, there's one other thing that needs to be stressed on. There are mothers who say they want easy labor, and so they take herbal concoctions, sometimes orally, sometimes through as enema. And what these things do, some of these herbs contain very, very potent chemicals that can cause the uterus to contract. And anytime the uterus contracts, it reduces blood supply to the baby. So it contracts for some time, then it relaxes so that the blood supply to the baby will be optimum again. But these chemicals cause sustained contraction. So the uterus is so hard, contracted, and the blood supply is cut to the baby for a very long time. And when the baby comes out, it's asphyxiated. So mothers, so back to the question, mothers, you are responsible to a large extent. You know, the health workers have their role to play, but the mothers too, you have your role to play. Make antenatal clinic visits a priority. In fact, before you even decide to get pregnant, there are some things you should do. Make sure you are in good health. We even recommend that they start taking folic acid. Folic acid helps the brain to develop. Of course, the brain controls everything in the baby. So if the brain is also not developing well, what will tell the baby to breathe well when it comes out can also be affected. So pre-conception, before you take in seed, make sure you are in good health, you are eating well, you are taking folic acid, you have a good blood level. Okay, your HB, that's HB, you are not anemic, you are not pale, your blood level is good. And then as soon as you realize that you are pregnant, visit the hospital. Okay, don't wait till after the first 3 months to say that, oh, let me see if it will hold or the pregnancy will still be in there after 3 months before I go. No, go. First 3 months, very critical. Okay, and then subsequently, the visits are also good. Take your medication, they give you, they assess you. If you also notice anything, any abnormality, anything that's going wrong, you visit the hospital. Sometimes the women are there, they start losing the fluid that the baby is lying in, which is the liquor, and then they want to wait and see. No, you have to go to the hospital. When you feel that you are having headaches, you are feeling dizzy, your heart is beating faster than normal, don't say, let me wait and see. Watch and wait. No, you visit the health facility. If you go to a health facility and you realize that they are not giving you what the care that you think you should get, it's always okay to seek a second opinion. You can go to another health facility. So you read, so you have to educate yourself. Listen to the radio or other TV shows like these ones where you know what you are supposed to do or what is to be done for you when you go to the clinic. And if it's not being done, so your BP is supposed to be checked, they should check your urine and all that. If you go to a facility where they are not doing this, you can ask. If they are not providing them, you are at liberty to go to another facility where you will get the help that you need. So educate yourself, make sure that you are okay before you taking seed. As soon as you realize you are pregnant, go to the hospital. And when they tell you to do something, please comply. You can ask questions if you are not okay with why they are asking you to do. Once it's settled for you, comply. And don't do things that you've not been asked to do, these herbal things, concoctions and all that. It can affect your baby. So a lot depends on you, the pregnant woman.
Thank you very much. Ms. Donna, any others?
To add on to what Dr. Gloria just said, I think there was one phase that maybe we forgot to touch on. That is during the second stage of delivery. Most mothers, after they've taken these concoctions and all that, get tired. And for that matter, when it's time for them to push their babies, they have no strength to do so. And this baby's head gets tugged up and they come out just floppy. So we are begging mothers, we are begging pregnant women, please, when it's time for you to deliver, the moment you realize that you have your contractions, come to the hospital. And under no circumstance should you try to induce labor on your own, to say that you want fast delivery, you want a warm, so you are taking in something either by mouth or enema to just speed the process. Because at the end of the day, yes, you go through a very speedily process, but your baby, we are talking about the baby. Pregnancy is all about you giving birth to a healthy baby. So what is the essence of rushing things and then these babies come out and you still have to even stay in the hospital to even take care of these babies? So we are begging pregnant women. We are begging pregnant women. When it's time for any procedure, you come for antenatal. Some people are doing very good. Some pregnant women, top notch. From day one till it's time, they are there. But you see something and you want to discuss with them, this is the situation, so this is what we've got to do, then that is where the difficulty comes in. You are in charge of yourself and your child, and nobody else. If your child dies, mostly you go home and they start blaming you. And yes, it's your fault. Do you get it? Some situations are just beyond our control. But I think as women, when we take our babies' lives and that into our hands, we are able to go through pregnancy well, delivery safely, and bring out healthy babies. So yes, your midwives are at your service. We have professionals, specialist doctors and all that also at your service. It's up to you to also do your best so that we can collectively make sure that these babies come out safely.
Thank you.
So we've talked about the fact that not everyone has access to an actual hospital with all the facilities. Some may have to go to the CHIPS compound, some to maternity home and whatnot. So in what ways can we improve the training for birth attendants in all levels?
Yes, so in places where they have midwives who are trained, they have pediatricians, they have pediatric nurses in a district, we work with the district's health directorate, and where we identify gaps, we go and do the training. Sometimes when there's an audit, so an audit is when a baby dies and then we have to go through, review the process and see what happened. And then we also use that as a teaching avenue. We invite the facilities that probably referred the baby, and then during the audits where the lapses were, if it was a deficit in knowledge or in skill, we use that opportunity to teach them. And then there are times that the people, actual trained health workers, move to the CHIPS compounds, the health centers, the other maternity homes, and then train them. We check, we go on monitoring, we see what they have in place, we can make recommendations for them where necessary, and then also see how we can lobby for them to have the equipment and then provide them with the training. So the district's health management team should work with the hospitals in their districts where they have trained midwives, maybe a pediatric nurse, a pediatrician, to ensure that all the health posts in the districts, the people there receive the adequate training and knowledge that is required.
Okay, so our time is almost up, but there are still some important questions I want us to talk about. So let's talk about the complications. What are some of the possible complications, and how can families care and provide support to these babies living with the complications?
Okay, so complications of birth asphyxia. We have milder ones to very severe ones. So we have milder ones like maybe child not being able to, let's say, sit up. I'm calling that milder because I'll prefer that to, let's say, my child not being able to talk at all, not even being able to go to school, not being able to potty train. So there are diverse of all these consequences. So sometimes, mostly when I'm educating mothers, I'm sort of trying to tell them that, yes, these things are possible. But there again, myself, this is what I would always choose. That maybe you might not be able to, because of neurological deficits to the brain. During birth, we do not know which side of the brain that was involved or that was oxygen deficit. And for that matter, you might not even know the consequences that will come. But most of them, you might get children not sitting up for the rest of their lives, who can't sit up. Some of them too might not, once you are not sitting, you are not working. Some too, potty training, they have no control over feces, urine, and for that matter, they would have to use diapers for the rest of their lives. And then there are children who can do all these things and yet they have low IQ. You get it? So they can walk, they can talk, but you realize that intellectually they are very low. And then there are some of them too, we have these people with kids with attention deficits. Yes, that one too is as a result of birth asphyxia. There are other serious ones. I don't know if I have to exhaust everything or doctor would also. And the most worst situation is maybe a child dying. There are so many other neurological deficits, a whole lot, plenty of them. I just want to leave that for her to go there because so, the neurological deficits involved is
a
just
myriad. It's a lot of them.
Yes.
So cerebral palsy, what she talked about, or developmental delays, and then you can also have problems with vision, and then hearing, epilepsy. These are all consequences that can result.
Yeah. Okay. Unfortunately, our time is up. So your final words to our viewers.
So we're saying that preventing birth asphyxia is a collective responsibility. People in the house, religious bodies, health professionals, and everybody. There is no exclusion. We are all involved. If we all play our roles well, we know that at the end of the day, we're going to have healthy babies, joyous mothers, and a happy family. And we all live together and develop well for great Ghana. Thank you.
All right. And if you also have a baby who was asphyxiated and so now has some challenges, okay, don't lose hope. God allowed the baby to live for a reason. And these days, there are advances in medicine. So you keep going to the hospital, go through the interventions, if it's physio, if it's speech therapy, if it's support at school, go through it. And then let's hope that as technology develops, medical advances keep going on, we may get something that can even cure cerebral palsy or cure these complications. So don't lose hope if you have a baby who has these complications.
Thank you very much to the both of you. Please, if there is any pregnant woman watching or any mother hopeful watching, please bear in mind that it is very important for you to attend your antenatal care. Be able to communicate with your healthcare providers so that if there is anything at all, they can spot it earlier before the time comes. Thank you very much for tuning in and see you again next week.